we can probably get started. That was probably not a full 30 seconds, but that's okay. So thanks everyone for joining tonight's information session to learn more about our Master of Occupational Therapy program here at Massachusetts College of Pharmacy and Health Sciences. My name is Hannah Castle. I work in our admission office here. And here with me, I have a few of my colleagues, so I will turn it over to them to introduce themselves to you. So Dr. Dowling, I will start with you.
Wonderful. Good afternoon, everyone. My name is Dr. Michelle Dowling, and I work in the Occupational Therapy department here at MCPHS, teaching curriculum, including adult rehabilitation, evidence-based practice, vision and cognition, and environments and technology. I have about 33 years of clinical experience, and the program here at MCPHS is very sound and strong when it comes to understanding the clinical concepts in occupational therapy. So I really am happy to be here, and I look forward to meeting all of you.
Awesome, thank you. And Maura, do you want to go next?
Yeah. Hi, my name is Maura. I'm a current first-year student on the Manchester campus for OT. My undergrad, I completed it at MCPHS as well in health psychology.
And last but not least, Maya.
Hi, I'm Maya. I am a first year on the Worcester campus. I studied my undergrad at Boise State in Idaho, so I'm not from here originally, but I'm here now.
We're glad to have you. Well, thank you for that. So we are pleased to be here tonight to share more about our occupational therapy program here at MCPHS. So we have a whole presentation to go through with you today so that you can learn more about our program, admission requirements, all that good stuff. So if you have any questions as we're going through this presentation, there is a Q&A box at the corner of your screen, so feel free to leave any questions there and we will make sure to address those at the end of the presentation. We are also going to be recording this as well, so if by chance you need to pop out at any point, we will make sure to send you a recording of this. We also post it to our YouTube page too for you to refer back to later on. All right, so let's get started. So first off, just want to congratulate you on your decision to pursue a career in healthcare. As many of you know, healthcare is an amazing field to be in. The field is certainly in high demand, and especially with an aging population, the demand is only projected to increase over the next several years. And as future OT applicants, you probably already know that the profession has a very strong job growth outlook. And with that being said, our students here at MCPHS are finding job placements soon after graduation, some even receiving job offers before they graduate. And the field of occupational therapy ranks among the top healthcare careers according to US News and World Report. So you will definitely have a bright future in the field of OT. We do realize that returning for school for your degree is definitely going to be an investment both on your time and money, but based off of the job growth outlook and quality of education that we provide here at MCPHS, we do believe it's going to be a good investment of your resources. So good for you for taking that next step. And just a little background about who we are as an institution. So MCPHS is a health science specific university offering 100 programs in many different fields. So healthcare is our specialty, and that's what makes us unique compared to a lot of other schools that offer OT programs. And many of our faculty actually continue to work at clinical sites while also teaching at the university. So being active providers, they are constantly staying up to date on the current healthcare system and new treatments that are available to patients, which are always changing and evolving in the healthcare system. And we have been around for a long time. So we've actually been around for over 200 years at this point. We started originally with just a pharmacy program at our Boston campus. And over the 200 years, we have grown to expand. So we have a campus in Worcester, Massachusetts, as well as Manchester, New Hampshire, and we also have some online programs too. So in total, we have a little over 7,000 students studying with us from around the world, from all of our campuses and our online programs. And with that 200-year legacy that we have, this contributes to our clinical and fieldwork affiliations that we've been able to build with some of the leading medical institutions in the nation. So some well-known sites where our OT students regularly complete their fieldwork include Elliott Hospital, there's Catholic Medical Center, St. Vincent Hospital, Northeast Rehab, Encompass Rehab. There's many other ones. Those are just a few to name. So it's definitely a great place to pursue your OT degree, and a lot of opportunities that you will gain exposure to in the program, which we will dive into in a couple slides from here. So before going into the program, I just kind of want to talk about some services and opportunities that will be available to you as a student here at MCPHS. I do think that this piece is super important when comparing different graduate programs. So MCPHS is a very hands-on program with a lot of services that we provide our students here, which are all included as part of your tuition as a student. So starting with interprofessional education, also known as IPE here at MCPHS. As healthcare is moving to incorporate greater teamwork and collaboration across professions, we are striving to prepare students for such encounters, which is why we've made interprofessional education as part of our mission here at MCPHS. So at least once per semester, students in our programs participate in IPE activities where they engage with students in other programs. So for example, you might work with nursing students or pharmacy students or optometry students or even PA students. And as an OT, you will have patients that are seeking care from other healthcare specialties. For example, if your patient has low vision, they're likely also working with an optometrist. So through these IPE activities, we're looking to foster that teamwork between specialties in early stages of our students' careers. So it's really a great way for students to learn about other healthcare professions, how to work with patients from other cultures and backgrounds, and how to work as a team once employed in the healthcare system. So with that being said, I'm actually going to turn it over to our students. I'm hoping maybe you can share some of the IPE activities that you've been able to be a part of here at MCPHS. So Maura, do you want to go first?
Yeah, so throughout our time here at MCPHS, you're going to attend 3 IPE events. The first one is just a basic one, kind of gaining that foundation. Second one, it was a book club. And then our third one that is actually next Tuesday, we're doing it with opioids and how each profession can kind of treat patients throughout that. So we're getting Narcan certified, how to properly administer it, and just educating other professions how we can treat certain diagnoses. So with this one, how we can also treat patients that are having opioid misuse. So it's all very informal or informational. And then we also get to practice our elevator pitch of what OT is, because a lot of professions do not know what we do. So with that, we get to educate them as well, which is really nice.
Wonderful. Thank you, Maya. Anything that you would add to that, or she hit it good?
More hit it pretty good, but I would say that it's also just like time to kind of expand looking at like a client from different points of views, because you kind of get everyone's input on different clients, especially with the book club that we did. You all read the same book, but it was just interesting to like you just sit there and talk through it with other individuals, and like they all have like their own lenses of like pharmacy or nursing, and just to kind of give your own perspectives on how like you are going to be collaborating on a team with them like in the future in the real world, and being able to kind of like respect where your boundaries are and understand like where like you each kind of fall and what your job is.
Wonderful. Yeah, we are really striving towards that teamwork approach, which will definitely be beneficial for your future as an OT. So thank you for sharing those. Now we do also have different student support services. So Maura, I'm actually going to turn to you to share a little bit more about the different services that we have here at MCPHS for students.
Yeah, so here we have a wide variety of proactive and inclusive support services. So we have the faculty advisors, which in my case, it's a professor within my at the Manchester campus, and they're just there for you if you have any questions. They're more than happy to answer them. They're really there for you, especially for the first semester when you're new. They just have great advice for you. We also have our academic coaches. So if you need help within certain courses, they're there for you as well. We have peer tutoring, which is a second year student. They can hold one-on-ones. They do a few group things before like midterms and finals, which is very helpful. We also have student life, which is just a bunch of organizations and groups, which is really nice. So you can get involved that way. And we also have career services. It just offers a lot of support that is very beneficial to use. You have it at your fingertips. So it's very nice to have that, because I feel like a few schools don't have it, and we just have that great support. And if we need it, they're more than welcome to help you. We're more than happy to help you.
Wonderful. Yeah. And do you want to touch on some of the clubs and organizations that OT students are able to be a part of? Because I know there are quite a few different OT ones, and there's also non-program specific clubs that you can get involved in too. But do you want to speak on the OT specific ones, Maura?
Yeah, so we have two. We have SOTA, which is the Student Occupational Therapy Association, which it's just we plan fun events. I'm part of the e-board, and I'm pretty sure Maya is as well. So she can probably jump in here. I know for the Manchester campus, we're planning some fun events, especially for the first years. We have some things in the talks. We're just waiting for some things to get approved, but we do some community outreach. We do volunteering. We do events within our cohort, especially when the first years are there. So the first and second years can get to know each other better, which is really nice. Coffee talks, that's when first years can ask second years any questions that they have, just to gain better perspectives of what your years ahead will be like. We also have COTAD. Oh God, I always forget what it stands for, but it's just diversity within the OT profession. So that I know on our campus, we've had speakers come in, they'll do workshops with ASL. Today they did a tie-dyeing event. So if you donated some canned goods, you could tie-dye some socks, which is really cool. But yeah, just fun stuff that helps us as the OT school, and also people out in the community as well.
Wonderful. Thank you. Yeah. And COTAD, it stands for Coalition of Occupational Therapy Advocates for Diversity. So it's the long-winded way of saying COTAD. COTAD is better, short. But we did put our Instagram handles in the chat here. So there's a lot of great videos and resources that we have posted on our Instagram about different fun things that those clubs and organizations have been able to do and be a part of. So feel free to check those out and follow us if you do have an Instagram. All right, so moving on to talk a little bit more about our campuses. So our occupational therapy program is offered on our Manchester, New Hampshire campus, as well as our Worcester, Massachusetts campus. So we'll talk a little bit more about each campus. So we'll start with our Manchester campus. This is actually located in southern New Hampshire, which is about an hour north of the city of Boston. The campus itself is actually located right downtown in Manchester, which is known for its New England charm of small businesses and shops, a lot of local restaurants and historic architecture. And you're also within a short walk or drive from campus. So, or within a short walk and drive from campus, you have access to a lot of different things in the city of Manchester. So, different things like parks and museums. We have local sports. We have the local Fisher Cats here. So, if you're into baseball, you can go watch a game. We have local and historic theaters that offer different acts and plays and comedy shows. We have a huge concert venue right downtown, and there's much more that you can do in the city of Manchester. We're also well placed for a quick ride into Boston if you want to go to the large city for the day. We are also located centrally near the seacoast, the lakes region, and the mountains. So if you're into the outdoors, which a lot of our students are, that is within a close distance from our Manchester campus. Manchester and the surrounding area is also home to 15 different colleges and universities. Our campus itself was founded and established in 2002. And we have since grown to incorporate 4 different healthcare programs here. So beyond OT, we also have a nursing program, we have pharmacy, and we also have a physician assistant studies program. But all the programs that we offer are all accelerated in nature of some sort. So we have roughly around 400 students studying with us in Manchester. So the smaller campus makes for a more intimate, close-knit atmosphere. And, you're definitely going to get to know your classmates very, very quickly, but you'll also become very close with your faculty members. So it's a great support structure that you'll have throughout the program. And we're also very close by to a lot of different healthcare facilities around Manchester and in the city of Manchester. So you'll get exposure to those clinical or fieldwork sites during the OT program here. So it's a little bit about our Manchester campus. We also have, like I said, the program in Worcester as well. So Worcester is in Massachusetts. It's actually in central Massachusetts, which is about 45 to 50 minutes from Boston, and about maybe an hour and 15 minutes or so from our Manchester campus. And Worcester is actually the second largest city in New England right after Boston. And you can definitely find healthcare right at your fingertips near our Worcester campus. Actually, within a close distance, you can find St. Vincent Hospital, and you can also find UMass Memorial and many other sites nearby within like a 10-mile radius from the Worcester campus. So a lot of opportunities there. It's definitely an up-and-coming city, which has a rich history too. It was recently deemed, according to NPR, the new IT town. So it's definitely been revitalized over the years to incorporate a lot of modern buildings and different restaurants and shopping plazas, live music, concerts, a lot of historic facilities that you can go to, different parks and arenas. So there's a lot that you can do in Worcester, very similar to Manchester, just a little bit of a larger city feel. And there's a lot of different colleges and universities nearby the Worcester campus too. So you will be surrounded by other students. And on our Worcester campus, we do have other programs besides OT as well. We have nursing, PA, acupuncture. We have a diagnostic medical sonography program, dental hygiene, physical therapy. I think I got them all there. There might be a couple that I'm missing, but we do have other healthcare programs on that campus as well too. There is also university-sponsored housing available, so if you are interested in living on campus, we have a bunch of different options that are available to students. And on both campuses, we have a lot of clubs and organizations. So as Maura and Maya had mentioned before, you can definitely get involved in some of those if you are interested, regardless, of the campus that you're attending. So now we will turn it over and talk a little bit more about our Master of Occupational Therapy program. So this is a fall start date. So it begins in September of each year. It is a 24-month program year round. So it goes by very quickly. And you will gain hands-on experience in this program. It's a very, very hands-on program. You'll complete a couple different fieldwork rotations. You'll do level 1 fieldwork experiences, which relate to the subject matter being taught each semester. So for example, since the second semester is primarily mental health focused, students often find themselves leading group sessions in their field work. And you also complete other level 1 fieldwork rotations in a rehab setting and pediatric setting. And then you will have your level 2 fieldwork rotations, which are a little bit more in-depth than your level 1s. And those will take place in your final 2 semesters of the OT program. So you'll have 2 12-week rotations, one in an adult setting and then one in a pediatric setting. And then in terms of our class size, so we have a class size of 45 students, so 45 in Manchester and 45 in Worcester. So no matter which campus you choose, you can expect to have around 45 students in your cohort. So I am actually going to turn it back over to our students. Maya, I'm actually going to have you share maybe what does your schedule look like in the program? Because I know you have a mix of classes, labs, and your field work. So what does that look like on like a day-to-day basis for you?
Okay, so a day in the life. So I have class in person Monday through Thursday, and it's in the morning. So it goes from like 9 to around noon. And then on 2 of my days are a little longer. So one of them I am doing lab, which is about 2.5 hours, 2, 3 hours. And that's just once a week right now. And then I also have field work. How it kind of just depends on whoever you get placed with. But right now I'm at UMass and I have been going or Wednesday afternoons. So you kind of go there for 3 or 4 hours. So definitely most days in the afternoons you have like the day to just work on homework, or if you like have a part-time job, you can go and do that. I know some of my classmates are doing their field work on Fridays, so I chose that. I kind of wanted that day off, but it just kind of depends.
Wonderful. And then I know in your second year, which you're going into this coming fall, you'll kind of flip-flop your schedule. Is that right?
Yeah, so going into the fall, since we will have the first years, they will be in the morning. So our classes as second years will be in the afternoons. And it also helps because we're going to be on a pediatric rotation for clinicals. And it's just sometimes easier to see children in the morning rather than later in the afternoons, especially like if you are doing your clinicals at a school. Obviously, like the kids aren't there super late in the day. So it definitely like works out better for that as well.
Yeah, that makes total sense. Well, it's all exciting. Well, thanks for sharing your schedule. It's definitely helpful because I know we in the admission office get that question all the time is what does the schedule look like? And OT is kind of unique because it's a more flexible schedule than some of our other programs, which is great. Because like you said, if you have a part-time job or a per diem job, students have been able to manage that while doing the OT program here. So that's wonderful. Well, thank you. So now I am going to turn it over to Dr. Dowling, and she is going to share more about our OT program and what makes our program unique compared to others.
Yes, thank you very much. So this program is scaffolded and threaded like no other program that I have seen. We have several themes throughout the curriculum that make our program unique from anything else. First and foremost is the mental health and wellness theme that you'll see when you journey through this curriculum. So you may not remember or be aware that OT originally began its roots in mental health. And we've moved away from it a little bit and began to focus on this medical model. But recently, we have made great efforts to return to those roots and return to our whole mental health theme to put a stronger focus on this back in our programming so that we can give that kind of care to our clients. So as a newer program, we were able to incorporate a much stronger focus on this area. And as you move through this curriculum, you will notice that emphasis of mental health throughout everything that we're doing. It's woven intentionally throughout our curriculum. Second, my favorite, and maybe yours too, is research and scholarship. So we feel very strongly that evidence-based practice is necessary. And for this reason, a research course is offered every semester during the didactic portion of the program, and it gives students opportunities to learn how to incorporate research throughout their fieldwork, especially level 2, regardless of whatever setting they're in. Outside of the classroom, we'll host New Hampshire OT Association conferences. I attend that. I am the New Hampshire representative for the state of New Hampshire. Even though I teach in Worcester, I definitely hold strong roots in research for that program. And so we then have our second year OT students. They're able to present at this conference. And we've even had our second year students present at the Massachusetts OT Association, which I got to do with them. And that was very meaningful for them. They presented their statistics on wellness and meditation and how that impacts function. So this evidence-based practice is very important for our clinicians as they enter that allied health profession. Would either students like to talk about their experience with research thus far?
I can a little bit. I mean, coming into the program, I definitely was not the biggest fan of research, and this program is definitely like you have to get comfortable with it. It's going to happen every semester, but I guess it kind of is more in a way of everything that you're learning is definitely something you're going to be using out in the field. So, you may not realize, but like every decision you're going to be making is going to be based on research, and like that's what's going to show out in the real world. Like, yeah, this technique works because there's that research supporting it, and you've done that research yourself to know that like this is something that's going to like help with your clients' improvements.
Excellent. Thank you. Maura, do you have anything to add or should I continue?
I can say something really quick. Just the first semester, it was very helpful because we started our level 1s our second semester in mental health. So our first semester, we kind of used that research that we were using to build a plan for the whole semester for our first semester or our first level 1 fieldwork. So that was very helpful as well.
Absolutely. Thank you for contributing those two lenses on research. And also everything we do every day in the clinic is research. When we move someone through their program, it's based on the evidence we're seeing that the client is even doing, that their numbers are improving. That itself is evidence. So we appreciate that evidence guides us, whether it's from an article or what we're doing live and in the clinic, which brings me to the third part of our model, which is the clinic is classroom and classroom is clinic. So you're not only learning about this content about occupational therapy, but you're practicing and applying what you learn every day. So we have really fantastic classroom spaces on both campuses that are designed to mirror the OT clinic. And our adult labs are equipped with full kitchens and bathrooms and various adaptive equipment, splint pans, and we make all sorts of things in those classrooms. And we have a sensory gym with lots of sensory integration and equipment, so you can typically see what that would be like when caring for pediatric patients. We have sensory swings and all sorts of fun tools and toys to play with and learn about as to why they bring about change for our clients. We also incorporate a lot of technology. So we use the Bioness, which our students are able to see and feel and experience. It's a form of therapy, neuromuscular electrical stimulation. We use virtual reality in many of our classes, and we make sure that our students are engaged in that kinetic learning experience. We're going to make it fun by having group discussions, Kahoot games, guest lectures, and we introduced 3D printing for the first time this year. So we have really tried to have our students experience what it would be like to be in that classroom as a clinic experience as well. So we have faculty that are involved in research. All of our faculty are engaged in IRB approved research. Our director is conducting research on the use of virtual reality in the rehab setting and research in mindfulness. Some of our faculty are working with optometrists, including myself. I'm conducting some low vision research, as well as how our friends with vision loss manage their medications. We have faculty at the university looking at suicide prevention programming, and also certainly children's hospitals and conducting research with chronic pediatric pain management. So our faculty have presented at national conferences and local state conferences, including Massachusetts and New Hampshire, and the recent Kansas City 2023 National Convention. We have one of our faculty members who's the president of the NHOTA. She's done so much with policy and legislation and advocacy. And certainly I'm one of the representatives for the AOTA. I represent the state of New Hampshire. So our faculty are very dedicated and immersed in clinical programming and allocation of care, as well as advocacy and research. So we are walking the walk. We have a lot of community connections and field work preparation that we do. We work very hard to make sure that our program is unique within our community connections. We develop and foster and cultivate really good relationships with our surrounding community so that we know our students have opportunities for hands-on learning. We have sites in Manchester and Worcester that we work regularly with, especially for those level 1 rotations to get our students starting strong. And lastly, those community connections really help our students become prepared for their level 2 fieldworks. And they may venture throughout the country to fulfill those requirements. Level 1 fieldwork rotations correspond and focus on each semester, so the students can come back. In my class today, just sharing all of the adult rehab and physical disabilities that they explored, and they can share with their professor who does pediatrics everything that they're learning simultaneously on level 1 with their didactic experience. So we make sure that we provide this cohesive experience for fieldwork and their didactic learning. Do the students have anything else to add to that? All right. So if I may, I'd like to give you an overview of the curriculum. We try to focus in each semester during the didactic portion of the program to provide excellent foundational information. So the first semester is very mental health oriented. And again, this will stay throughout the program. But our students are learning about the concepts of mental health and occupational therapy and those roots. Our second semester focuses mainly on physical disabilities and rehab. We're learning about adaptive equipment and assistive devices and conducting evaluations and interventions for individuals with sensory motor impairments. Semester 3 pulls in the neuroscience, adult rehab, and upper extremity injuries. We're talking about stroke, spinal cord injuries, and neurological disorders. Semester 4 is when you'll take your pediatric courses, and you'll also have some specialty courses such as cognition and vision and program development. Then semester 5 and 6, you'll go on your level 2 rotations. I do want to point out that during your fieldwork, you will also be taking online courses, which are really geared towards helping you transition out of the student role and into the professional role. These courses focus on things like organization, documentation, and needing to register for those boards, as well as obtaining licensure, building your resume, and joining and supporting OT organizations such as the one I serve on. You'll also notice that level 1 and 2 fieldwork, which are indicated by those stars, are important to talk about. So the purpose of level 1 fieldwork is to really introduce you to different practice settings that occur in conjunction with your didactic courses. It might be a full 2 weeks, or you might be going once a week across that full semester. Level 1 fieldwork rotations don't have a ton of hands-on work. You're there to just observe, and that you then can take back what you've observed and chat with your professors about what you're seeing. And you will be leading groups with your supervisor during this time. Level 2 is a 12-week experience working full-time, following the schedule of your supervisor. So if your supervisor works 7 to 3, you work 7 to 3. If your supervisor works 6 to 2, you'll work 6 to 2. And that may vary depending on the setting. You might do 4 10-hour days or 5 8-hour days. You might also include working a weekend or an evening. So you're following your supervisor and you're providing that population what they need. You'll have one rotation, which will be in pediatrics, and the other will be working in the adult setting. And this is what you will find across all schools because it is mandated by our ACOTE accrediting body. So we do have flexibility in terms of the location of your level 2 setting. And many students stay in New England, but some head back home or choose further locations. So we've had students complete level 2s in California, Texas, Florida, because they want to be closer to their families or they want to experience something new. We have fieldwork coordinators on both campuses that will help you with this process. And I'll pass that on over to our students or to our admin if they'd like to discuss that further.
Great, thank you. Yeah. So I am going to turn it over to our students. So Maura, do you want to talk a little bit more about your didactic year? Because I know we went through the curriculum and stuff, and I know you're still in your first year. So do you want to share a little bit about how it's been so far, maybe what your favorite course has been in the program so far, and how your level 1 rotations are going for you?
Yeah. So far didactic has been really great. I've learned a lot. So as Dr. Dowling was saying, like that first semester is kind of your foundation. You build your base knowledge and then you build up from there. Last semester I had my first level 1 that was in mental health, and that was when we were leading groups. That was a really good placement. I enjoyed it a lot. My favorite course so far, oh goodness, I'm gonna have to say either motor or adult rehab currently as well. Just gaining so much knowledge of what OTs do in each setting with each diagnosis. My level 1 currently, I'm in acute care at Burlington, so Leahy Burlington. And that I have seen so much, and I've only been there twice. My first week I was in the surgical ICU, so I saw a lot of like heart attacks. So just right after surgery, how we can treat them, a lot of precautions that we'll have to be taking with them, strokes. I've seen a lot of strokes. Let's see what else. Some TBIs, just a lot of interesting stuff that we are seeing in the classroom. So it's really nice to see what we're doing in the classroom in real life and how to apply that and how therapists are treating the patient, but they all have different ways of treating the patient and having the same outcome. So that's really great so far. And I go on Fridays from 8:30 to 12:30 as well. So I get to see a lot within those 4 hours.
So fun. Exciting. Well, thanks for sharing. Maya, anything you want to add?
I mean, pretty similar, like just that, it's so applicable right now. I'm on a neuro floor at UMass, Chan, and they, we're in a neuro class right now during the semester, so it's really carrying over. It's also, I sometimes like can be a little like overwhelming, but it does like help that it's kind of easing us in, and like you are just observing. So like you might have a lot of questions, but I also like have been very surprised with how prepared I have been and how much knowledge I already have. But it's also nice that like, you're not just like jumping in and having to treat these patients. Like it's like, okay, I can observe and I can ask all these questions and really just like take it all in, because, like these people are people like the therapists that you're observing, like they're really talented at their jobs, and like they've been through what you've been through, and they're just there to like help you grow and stuff.
Amazing. Well, thank you. Yeah, and all those experiences are preparing you for, the end goal, which is to become an OT. And pretty soon you'll be almost doing your level 2 rotations. Yeah, like we mentioned before, level 2s, you can do them locally. There is an opportunity if you wanted to go home and do them. You'll have a lot of opportunities there, and you can put in your preferences as well too, but you'll work very closely with the clinical coordinator to make sure those are set up. So Maura and Maya, you will be there before you know it and doing your level 2 rotations. So very exciting. So we love telling you all about the great things that MCPHS and our OT program has to offer, but honestly, the proof is in the statistics. The OT program has a very strong track record in terms of outcomes. And as you can see here from the slide, we are building a legacy of strong graduation rates and board pass rates. And like I mentioned at the beginning of the presentation, our students are finding jobs quickly after graduation, and are also well rated by their employers. So if you do decide to attend MCPHS, you can certainly expect a high quality of education that prepares you both for the board as well as professional life post-graduation. Dr. Dowling, do you want to share what some of our grads have been able to do and maybe some areas that they're working in?
Absolutely. It's a big landscape of where our graduates are working. So after graduation, many students will typically work in an inpatient or an outpatient hospital or a clinic setting. Some choose to work in schools or home health or community-based programs. As the field of OT continues to grow and OT finds themselves getting involved in many non-traditional areas of practice, such as driving rehabilitation, ergonomic specialists, home and community redesign, outdoor and hippotherapy, vision, and development of robotics, and definitely virtual reality development. So a lot of wonderful areas that OTs are now having a seat at the table in allied health.
So cool. So many opportunities within the field of OT. So I'm excited, Maura and Maya, what you will accomplish in your future. And hopefully after today, you who are listening, our members who are listening will consider applying to our OT program to start your journey towards your future as an OT. So I'm going to walk you through the application requirements, how to apply, all that good stuff. So we have rolling admission here, which essentially means that we review applications on a rolling basis. So our next cycle, which will actually be fall 2025, is going to open up on July 21st, which is just right around the corner. So if you are interested in applying for next fall, we welcome you to submit an OT-CAS application. So although the deadline is listed at March 1st of next year, we do have, like I said, that rolling admission. So we will start reviewing applications shortly after the OT-CAS cycle opens. So feel free to go ahead and apply in July. And once your application is verified, we will be sure to review it. So in order for your application to be verified, you have to make sure to complete and submit all of the requirements on OT-CAS. So, all the basic information about your name and your education history and all that good stuff. And then you also want to provide a resume, a personal statement describing your goals and reasons for going into the program, 2 to 3 letters of recommendation. So all those would need to be submitted to OT-CAS specifically. So you wouldn't want to send them to MCPHS, you'd want to send them to OT-CAS, that way they can verify your application. And I know previously we mentioned this program is available at our Manchester and Worcester campuses, but you can only apply to one campus in OT-CAS. So just take note of that. You'll just need to make sure to select one campus. If you are kind of tossing between which campus you want to apply to, my biggest piece of advice would be to come for a tour. There's no better way to get a feel of the campus than to see our community. So feel free to register for a tour. Other thing I wanted to note is we do not require the GRE for our program, so you do not need to submit that. And we also do not require an interview. So pretty streamlined application process. If you have any questions along the way, you can certainly feel free to reach out to our admission office as well. There are a couple prerequisite courses that are required prior to entry into our OT program. You are more than welcome to apply with some of these courses in progress. You just need to make sure to have them done before you start the OT program. So the courses are listed here up on the screen. So it's just anatomy and physiology 1 and 2 with labs, abnormal psychology, either an adult, adolescent, child, or lifespan development course. 9 credits of social science electives, so that would be equivalent to 3 courses. That can be an additional psychology course, sociology, history, political science, cultural studies, anthropology, women's studies, ethnic studies, government, and economics. So all those courses would count towards social science electives. And then the last prerequisite course is statistics. So all those courses, again, would need to be complete before you start our OT program. They have to be complete with a C or higher from a regionally accredited college or university, and that includes online courses as well as community colleges. If you are by chance missing any of these courses and you want to take them, whether that be over the summer or fall or next spring with us, we do offer them through our School of Professional Studies department online. And they're self-paced courses. So feel free to check those out on our website and register with us if you want to, or you're welcome to take them at any other regionally accredited school of your choosing. And then financial aid is available for this program as well. So all domestic students with a valid FAFSA on file will be considered for financial aid. So you would fill out the graduate FAFSA when that becomes available for next year. And we also consider students for merit scholarships for our program as well. So once we receive your OT CAS application, as we are going through the application review process, we will consider you for a scholarship at that time. And if you have any questions as you're going along regarding funding the program, we do have a student financial services department that is more than happy to meet with you. They can talk through the different options with you. So feel free to schedule an appointment with them if you'd like to talk further about your options. So that is it for our presentation today. So we hope that you learned a lot about our OT program and you'll consider applying for next year. We did put up here our contact information. So I work with all of our Manchester applicants. So feel free to take my contact information down. My colleague Amy, she works with our Worcester applicants, so you can take hers down. We have a lot of great YouTube videos available on our channel, so check those out. In this summer, we have a couple events happening. We have some campus tours, and we're also going to be having an open house. We have one at our Manchester campus and one at our Worcester campus. So the Worcester one is on July 11th. The Manchester one is on July 18th. Both of them are from 5 to 7:30 p.m. So this will be a great opportunity for you to come to campus, see campus, get to meet faculty and students in person, get to see our facilities, and then we'll have a little barbecue dinner for you as well. So feel free to check out our website, just mcphs.edu/visit to see all of our different events that we're going to be having, and we hope to see you there. So we will stick around for a couple minutes to see if anyone has any questions. So feel free to leave them in the Q&A box, and we are more than happy to answer those. So I guess I'll start with a question to start us off for our students. So why specifically did you choose to attend MCPHS? Because I know there's other OT programs out there. So what made you choose MCPHS specifically? Maya, do you want to go first?
Sure. I think a big factor of me moving out here was that the level 2 field work being able to be done anywhere. I am actually like going back to Idaho to do it back at home. And it's been honestly a fairly easy process with having them like help our coordinators help me out with finding those placements and just being able to like work with me on, kind of choosing where I want to go and not just being like, okay, you have to go here. It's really up to you. So that's been a really big plus.
That's exciting. Yeah, I know we had somebody here in Manchester who went back home as well. She went to she lived in Georgia, so she did hers in Georgia. So that's very exciting that you get to go back home and be with your family and everyone too. Wonderful. We actually did get a question that popped up. So someone asked, is there a minimum or maximum length for the personal statement for your application? So Emma, we recommend writing at least 500 words describing your goals and reasons for going into the OT program. Honestly, you can structure your essay however you want. Everyone has such a different reason for wanting to go into the program. So feel free to write it however you want and share your story in there. But ideally, we're looking for at least 500 words or so. All right, I don't see any other questions. So one question I'm actually going to ask Dr. Dowling is, what do you kind of see as some of the biggest challenges and rewards in the field of OT?
That's a great question. This career has given me, first of all, an incredibly, enriching meaningful and stable kind of life experience. Certainly, it's been a profession where I can move about from adult to mental health population to kiddos. I'm rounding out my career as a professor and working in low vision. So you're never going to get bored. There's so much we can do. I believe, like most people who enter allied health, with a compassionate, agenda. I care deeply about people's well-being. And so you see the journeys that some people take, and it's tough. But when you can make small and large changes for individuals to be able to return back to their valued occupations and meaningful activities, it's a great way to end the day. So occupational therapy really is a very enriching and wonderful profession for me for the past 33 years.
I love that. Thank you. Yeah, you're so right. There's so much that you can do in OT. It's wonderful. And everyone has such a different journey too. We have one more question that came in. Do you know what locations are available for field work for the Worcester campus? I currently work at UMass on Belmont Street. Dr. Dowling, do you want to address that question?
Sure. I am not the fieldwork person. I certainly am a professor, but I can tell you that the fieldwork department does a very excellent job at establishing the wish list, and you choose your top 3 locations. Certainly, there are other students throughout the New England area that also have wishes from other universities. So they definitely try to have you fulfill your top number 1 wish for location. Certainly, having relationships with other facilities like you have is helpful at establishing new relationships and potentially developing new fieldwork sites. But we want to make sure that we continue to develop those relationships in a meaningful way, following our ACODE accreditation standards, et cetera. There's plenty of sites. You may have to drive. I know some of our students are driving 50 minutes or so to get to their site because there's many students out there that we want to meet their needs, and there's other universities meeting students' needs. That's why we continue to have a very strong and cultivate a very meaningful relationship with those sites. But it is 12 weeks, and I drive 50 minutes to be able to teach all of you. That means the world to me. But there were many jobs I had where one job I had was 8 miles away from home. So you do your field work and you embrace that opportunity and you cultivate those relationships so that ultimately you become a certified and registered therapist and then improve the lives of others you serve in jobs that you choose.
Great, thank you. All right, so we are kind of cutting it on time at this point. I don't want to keep everyone from enjoying this lovely afternoon and evening. So again, this will be recorded. So if you need to refer back to it, we will make sure to send it along to you and we'll post it to our YouTube page. But I just want to thank everyone for attending today's information session. We do hope that you learned a lot. And thank you to our students and Dr. Dowling for joining us and sharing all that wonderful information about our OT program. Hopefully you're able to join us for one of our events this summer. We'd love to meet you in person and stay in touch with any questions. Enjoy the rest of your evening, everyone. Thanks again. Bye.